So now history in that history, what you can take, a good sexual history, where you have to ask about coital problems, what is the frequency of sex, pain or inability to have sex, and whether they use any contraception or not. Because when people come and tell us, we have been trying for almost 6 months and we have not actually conceived, out of which 3 months they might actually have used they might not have had sex during the fertile period or some things like that, or they might have used some lubricants which can actually be spermicidal. So it's very important to ask for a sexual history. Then comes the menstrual history. So always LMP, okay. Then regularity of the cycles, whether it's cycles irregular or regular. So regularity means it's not always 30 days. Children, it's according to the ACOG, it's 21 to 35 days. Then periods on own or it requires withdrawal, PCOS. Then pain which will indicate towards adenomyosis or endometriosis. So the second history which you will ask is the menstrual history. Then the third history is the previous pregnancy history, if any. See, primary subfertility or infertility is when one has never conceived, and secondary subfertility is when they have conceived and now not able to conceive for more than 1 year. So that is secondary subfertility. So now it could be, so now ask about the previous history, whether it was a miscarriage, whether it was an ectopic, okay. So this is all included, right? And what type, if it was a miscarriage, what method was followed for termination of pregnancy, whether it was a surgical evacuation or a medical termination. Usually surgical evacuation, especially repeated DNCs, will cause this condition called Asherman's, which means that there will be lot of adhesions inside the uterus, which will itself cause a subfertility. I see lot of women coming to me with very scanty periods. If probed, they give a history of repeated DNCs, and then they'll end up having this Asherman syndrome, or it can also be very common in conditions of genital tuberculosis. Then very, very important is taking a good treatment history, okay, because we see these patients day in and day out. I make it to the point that I take a very detailed, I see each and every paper of their previous file and note it down. I ask my assistants also to note down the same. See, what is the type of treatment, whether it's ovulation induction or IUI or IVF, what they have undergone previously, what was the medicines used, if it was ovulation induction or IUI, what drugs were used, how many follicles developed, what was the endometrial thickness, was the trigger injection given or not, if it was an IVF, then what protocol was used, then what was the injections that were used, how many embryos formed, how many eggs were collected, okay, all these become a very important. And if it was transferred, whether it was positive or negative, and how many embryo transfers or how many cycles of IUI were done. So this is also very, very important, okay. So taking a detailed previous treatment history for a fertility is the most important thing. Then medical history, that's usual. So you can ask for thyroid, diabetes, hypertension and other things. But as far as fertility is concerned, thyroid and diabetes can cause both male and female fertility issues, can cause poor sperm egg and health and increase the failure of treatment, and can cause miscarriage rates, especially when the HbA1c is more than 8, then we should not allow the lady to become pregnant, because once she becomes pregnant, she can have congenital anomalies in the child. And hyperprolactinemia, which can cause ovulatory disturbance. So it should always be important. First evaluate the thyroid. If TSH is normal, then if the prolactin is also high, then evaluate for hyperprolactinemia. Then comes the surgical history. Surgical history, what we have to ask, whether there was any previous pelvic surgery, whether adhesions were there during the surgery, which can lead to actually tubal factor infertility, or surgery per se, especially in case of infected appendicitis, can cause adhesions in the pelvis and cause tubal factor infertility. Now, family history we have to ask, especially early menopause in women who come with premature ovarian insufficiency. Personal history of smoking and alcohol in both partners is important. And what drug history, whether they are taking any psychiatric drugs which can cause hyperprolactinemia. Methotrexate and retinol tablets are category X, so they should postpone the pregnancy for certain amount of time. So all these things are very essential for us to know what was the relevant points.